What if you woke up during surgery but couldn't move or scream? Would you feel everything? It sounds like a nightmare, but for a small number of people, this rare phenomenon is real. So how does anesthesia actually work? And how can it keep Timmy unconscious, painless, and still during surgery? Thousands of years ago, in Borneo, archaeologists found the remains of a child who had undergone the very first known surgery, a foot amputation. Miraculously, the child survived, but imagine the pain. Today, Timmy is a lot luckier. Thanks to anesthesia, even getting a tooth pulled doesn't hurt at all. But what's really going on inside your brain when anesthesia kicks in? When Timmy goes under general anesthesia, it's not the same as falling into a deep sleep. His brain doesn't just switch off. It's actually closer to a medically controlled coma. In fact, many of the same drugs used to induce a coma are also used during anesthesia. The story of anesthesia is a long one. Ancient Mesopotamians tried alcohol. Egyptians literally pinched arteries in the neck until people passed out. The Incas chewed coca leaves before having holes drilled into their skulls. And the Arabs soaked sponges in opium, mandrake, and hemlock to knock patients out. Fast forward a bit, and we get nitrous oxide, better known as laughing gas, discovered in the 1700s. Then ether, chloroform, and eventually the modern anesthetics we use today. Now, there are different kinds of anesthesia. Local anesthesia numbs just one spot, like when Timmy gets a mole removed. Regional anesthesia blocks nerves in larger areas, like during childbirth with an epidural. Sedation calms you down, erases your memory of the procedure, but doesn't knock you out completely. Great for things like colonoscopies. And then there's general anesthesia, the full shutdown. Timmy won't feel pain, won't remember anything, won't move, and loses consciousness entirely. But here's the tricky part. You can't achieve all that with just one drug. Doctors mix a whole cocktail, carefully adjusted for each patient. Why? Because even if Timmy is unconscious, his body can still react to pain. In the past, patients' blood pressure would spike during surgery, sometimes causing strokes or heart attacks. It wasn't until the early 1900s that doctors realized anesthesia had to control pain as well as unconsciousness.
That's why modern anesthesia works in 3 stages. First comes induction. Drugs like propofol, midazolam, and fentanyl quickly put Timmy under, lower his anxiety, and block his memory. Then, maintenance. Gases like sevoflurane, muscle relaxants, and painkillers keep him still and comfortable while the surgery happens. Finally, recovery. Medications reverse the paralysis and let Timmy's brain slowly find its way back online. Waking up isn't as simple as the drugs wearing off. Timmy's brain has to re-establish connections, almost like finding a path through a maze. That's why strange things can happen. About 1 in 5 patients report dreams or sounds while under. Kids and older adults sometimes wake up disoriented, even agitated. And in extremely rare cases, people become aware during surgery but can't move, a terrifying phenomenon known as intraoperative awareness. Since 2007, only a few hundred such cases have been recorded, most in the US, and doctors constantly monitor patients to prevent it. And then there's the funny stuff. Some drugs cause disinhibition, so Timmy might wake up babbling nonsense, laughing uncontrollably, or saying the same phrase over and over. The idea that you'll spill your deepest secrets or bank password? Mostly a myth. So, how safe is it really? Today, deaths caused purely by anesthesia are extremely rare, about 1 in every 185,000 cases. The risk goes up with age or emergency surgeries, but overall, anesthesia is considered one of the greatest life-saving advances in modern medicine. In the end, scientists still don't fully understand every mechanism behind anesthesia. What they do know is that it interferes with the way brain cells communicate, preventing pain signals from traveling and shutting down awareness in just the right way. Without it, Timmy and millions of others would never have survived the surgeries that keep us alive today. Not magic, but science at its most powerful. And if you want to keep exploring the strange science behind the human body and beyond, make sure to hit that like button, subscribe, and join Timmy on the next What If?